and welcome to Mentally Detoured. The topic of today's video is medication to treat anxiety, and this is the part where I remind you that I am not a medical doctor or a pharmacist. The information that I'm gathering here is from the internet, so please double check my information for accuracy. An anti-anxiety medication or drug is one that inhibits anxiety, and these are also known as anxiolytics or minor tranquilizers. A great website to check out these and other psychiatric medications is crazymeds.com. I'm also using this website as one of my references. Benzodiazepines are a class of medication often prescribed for short-term use for severe disabling anxiety. Some benzos that you may have heard of, and I'm using their brand names here, are Xanax, Klonopin, Valium, Ativan, Librium, and Tranxene. This is not an exhaustive list of benzos, as that would be boring to listen to, but these are approved to treat anxiety. Besides being used to treat anxiety, benzodiazepines may also be used to treat epileptic seizures or for alcohol withdrawal. These drugs can range from somewhat to highly addictive and are not recommended for long-term use. Personally, I have taken two of these, Xanax and Klonopin, both in their generic forms. Generic Xanax, alprazolam, is best used for situational panic attacks or unresponsive anxiety and can be highly addictive. Because of the addiction possibility, I resisted taking Xanax even when my prescribed dose was 3 times a day. That seemed like way too much. I would only take it once a day. This worked well for me when my anxiety was only occasional or situational, but as it became more and more intense, Xanax didn't last long enough to keep it under control. It did not make me sleepy. It did enable me to face potentially anxiety-provoking situations more calmly, with a state of mind that I didn't really care much about what was happening. The truth was that my carrying of the situation was often intense, and often inappropriately intense. I still have a prescription to take it as needed. My psychiatrist switched me to Klonopin, generic clonazepam, which is more long-acting, and it allowed me to get control of my anxiety. Though I seem kind of anxious right now. I don't know why. I think I've done several takes. I take this drug right before I go to bed because it does have very sedating effects. Since not sleeping well can exacerbate anxiety, this side effect worked for me. During the day, I didn't have any side effects that I know of, except for waking up with the occasional Klonopin hangover, which is not uncommon. It's a groggy, headachy, hangover-y kind of feeling, and for me, the antidote seemed to be coffee. Memory problems can also be a problem when you take Klonopin, can be a side effect, and so whenever I forget anything, we just blame it on the Klonopin. That's got to be what it is. Klonopin is somewhat addictive, and when discontinuing the use, there is a potential for negative withdrawal effects, so tapering the dosage down is recommended. That is the process I'm currently in, and right now I'm only taking half a pill at night, and the sedation effect is not as strong. The serotonin selective reuptake inhibitor antidepressants, known as SSRIs, can also be used to control anxiety, though like they do with depression, some work better than others for different individuals. For me, I take the generic Prozac, fluoxetine, and as I decrease my dosage of Klonopin, I am increasing my dosage of Prozac to increase its anti-anxiety properties. Buspar, another anti-anxiety med, is a non-benzodiazepine that seems to work best taken to enhance other meds and is often used with SSRIs. It takes anywhere from 1 to 3 weeks to begin working, and it does not work for everyone. It is low on side effects and is non-addictive. Buspar has a very short half-life, so it must be taken 3 times a day. This is not a complete list of medications used to treat anxiety, but seem to be the first responders, so to speak. Psychotherapy can be an effective treatment for anxiety and may be recommended in combination with medications. Because anxiety also occurs with other mental disorders, The right combination of meds may take some tweaking to find out what works best for any one person. The combination of meds and talk therapy have worked very well for my generalized anxiety disorder. And remembering that worrying won't stop the bad things from happening, it just stops you from enjoying the good. Until next time.